I'm here as a child psychiatrist. In my role working at the Children's Hospital, I see children and youth and families who have troubles with mood, anxiety, or stress, or any manner of difficulties. But I'm also a father, I'm also a husband, I'm also a son, I'm a brother, I'm a neighbor, and so in all of those other roles, I have a lived experience with mental health issues. But I'll try and keep it mainly to my stated purpose as a mental health professional. I work at the University of Ottawa. I'm with the Ontario Centre of Excellence for Child and Youth Mental Health. And what we'll do today is we will talk for the next 25 minutes about how stigma of mental health is experienced by children, youth, and their caregivers, how stigma influences access and interaction within the healthcare system, and we'll talk a bit about research in this area. I'm actually a clinician, so I haven't done any research in this area, and it was funny when I was doing my research about this, I would be reading articles by Corrigan, Stewart, and Matheson, and then I was doing quotes from you guys in my slides, and then when I looked at the speakers invited, it was like, oh my goodness, you guys are actually going to be here. So I was actually very relieved to see that I would be speaking first, because that way it won't appear as if I'm stealing any thunder from you because I'm going first. So I'll just recite the usual statistics for those of you who aren't aware of them. And I used to not care about statistics, but nowadays we're always being asked to speak with the media. So it's nice to have some quick numbers to roll off the tip of your tongue. So for those trainees and psychiatry residents in the room and psychologists, psychology interns, it's still good to memorize these numbers. So we know the stats are 1 in 4 or 1 in 5 people in a year will have a mental health condition. It's the same whether it's children, youth, or adults. And unfortunately, with children and youth, only 1 in 6 will receive help. So can you imagine if only 1 in 6 youth with a medical issue would only receive help? We know that people who need mental health services suffer from very long wait times. And it is felt, of course, that stigma is one of the biggest barriers for people seeking help, as well as one of the biggest barriers for there actually being help available. And as a child and youth mental health professional, it is key that people get treated early because early intervention makes a difference. So we'll just quickly review some of the definitions of stigma. I'm sure some of you are experts in this. Maybe even some of you in the room are the ones who made the original definition. And first of all, there's self-stigma. This is the prejudice that individuals turn against themselves with when they're part of a stigmatized group. And in children and youth with mental health issues, this is why they often feel ashamed and embarrassed to talk about mental health issues. They may blame themselves for their difficulties, and this is one reason they may not seek help nor talk about their issues with others. So personal experience with this, I was asked to be a co-host on the CHEO Telethon in 2005. And so we too were begging for money on television. And it's always nicer to beg for money when you have people such as patients and families. And we had no troubles getting people with medical conditions like cardiac conditions or cancer or very, very, very rare conditions. You know, all the dystrophies, all the rare syndromes. But for one of the most common conditions like depression, anxiety, substance use issues, it was impossible. We could not find one single family who wanted to come up. And so we talk about systemic stigma, and this is one example, how even when we're trying to fundraise in order to get services, we can't find people. And this is not those families' fault. It's because of the stigma. And so the other type of stigma that we have is systemic and structural stigma. This is institutional policies that restrict opportunities of people with mental illness. For those of you who are coming out of the province, that picture is actually the Parliament in Queen's Park in Toronto. And in children and youth, it is felt that structural stigma contributes to fragmentation and lack of resources for child and youth mental health. Now, I know we all experience this. You know, all of us are involved in mental health somehow, and so all of us experience lack of resources. But definitely in child and youth, there's been a big lack. And one of the reasons, well, families are too embarrassed to complain about it. It's easier to find a family who feels comfortable talking about, needing more funds for a rare condition rather than a more common condition such as mental health issues. And once again, that's not their fault. How underfunded is it? Well, according to Patrick Lake, director of CAS in York Region, from the years of 1992 until 2011, funding for services in Ontario only kept pace with inflation in two of those 19 years. So in other words, many children youth agencies in Ontario are effectively working with $1992 despite the rate of inflation. Now recently there has been an infusion, perhaps because there might be a political campaign coming up, who knows, but up until now, services have been severely underfunded. Another type of stigma is courtesy stigma. This is the stigma by association by those who are closely associated with stigmatized people. And this is the stigma that we as psychiatrists experience, right? When I'm at a social gathering with colleagues, and let's say I have another colleague who's an emergency physician, and he or she meets people, they're like, oh, you're an emergency doctor, that is so cool. And when they meet people like me or you at a party, it's like, oh, psychiatrist, why'd you want to do that? So more on that later. So, and what's worse is to protect ourselves against the stigmatization, we then will also stigmatize those that we serve and work with. So we'll say, because the other big question people get when they meet a psychiatrist is to say, oh, you're a psychiatrist, so there must have been something wrong with you, right? That's why you're a psychiatrist. You must be dealing with your own issues. And so in the beginning, I had stigmatization towards those I worked with because I would be very quick to say, no, I don't have any issues, I don't have any mental health issues myself. But right now I will go on record as saying, yes, I have issues. We all have issues. Even if we don't have clinically diagnosable mental health issues, we all have issues. The other example of courtesy stigma is what my patients and families experience. So parents of a child with ADHD often find themselves shunned by other parents in the neighborhood. You don't want your kids playing with so-and-so's kids because they have such and such. You'd think it was contagious or something. And another example of this would be how child psychiatrists are seen as lower status by other professionals, and I'm sure my colleagues with the Canadian Medical Association can give examples of that. Another example of where we're moving with anti-stigma interventions nowadays is to call it for what it really is. It's discrimination. So we live in a day and age where now it's good that we cannot discriminate against people on the basis of race or religion. Mental health is probably the last thing that it's still freely acceptable to discriminate against. And so there are movements to recognize stigma as discrimination so we can fight with it, against it that way. So now let's focus and talk just a bit about child and youth stigma. So children's rights are actually a rather new phenomenon. Throughout most of history, there was no concept of child rights. Children were non-people, so it was free to abuse and even kill them if they had some defect or deformity. This is Mount Tegetos. Can anyone tell me why I'm showing you this? Spartans, exactly. And so in ancient Sparta, it is rumored that the Spartans would throw off any defective children from that hill, from that mountain. So Thank goodness we don't live in that day and age anymore. But we still throw our children into the chasm. We just do it in a much more sophisticated way. We deny them opportunities, we deny them services, we deny them acceptance. And what we're talking about with stigma is rejecting people. And that's actually one of the most powerful ways we can hurt someone. And as a child psychiatrist, we talk a lot about attachment. So I'll say just a few quick words about this rejection and attachment. So I love my wife. She's awesome. And for me, I think one of the most important things right now is to know that my family loves me. I could even deal with my family dying if I knew that they loved me. I could grieve that loss. But if I were to be rejected by my wife and family, I don't think I could deal with that. And so that's how powerful it is, that need to be accepted and not be rejected. And that's why stigma is so damaging for people. With children and youth, a lot of studies show that stigma starts early. In the schoolyard, children learn to use derogatory phrases like you're psycho, retarded, crazy from an early age. And I have to admit, even myself, when I have a really ridiculous day, I will use, the crazy word sometimes. And even today when I'm talking, I will probably use some sort of language which is stigmatizing. And that's because I've been trained in a system and a culture where it's just natural to use that language. It's really hard to change how we talk. Just the other week, I was doing a talk on suicide, so I kept saying committed suicide over and over again. And it's really hard to change. But I have, and then I have other colleagues who continue to use phrases like schizophrenic, but very hard to change. And this is not my wife paging me, so that's good. Okay, so stigma against mental health issues are also perpetuated by the popular culture, whether it's video games, movies. It's perpetuated by the sensationalism in news. And some studies show that young people nowadays actually have less favorable attitudes than adults towards mental illness. And naturally, stigma in our children and youth is particularly damaging because that sets the stage for future negative beliefs, and then it's much harder to change them. And it's important to talk about child and youth in the area of stigma because it is believed that programs starting early on are going to be the most effective. Now I'll talk just a bit more about other aspects of stigma. So I mentioned earlier with the example that when I tell people that I'm a psychiatrist, I get this, why would you want to do that, right? Or why did you decide to do that? Well, I remember, here's a funny story. I remember telling my father's a physician, and he's an anesthetist, an anesthesiologist. He puts people to sleep. And I remember telling him I wanted to be a psychiatrist, and then he just asked me again, so what did you say you wanted to be? And then I joke about it now, and I simply say, well, Dad, it's okay. I do want to be a doctor just like you, and we're both going to be working with the unconscious. So, but as time has gone on, my role has been more accepted. In Chinese culture, we have a lot of stigma against mental health issues. It's just not talked about. Frankly, in Asian culture, we're very good at dealing with basic needs. When you say hi to someone in Chinese, the saying is really, have you eaten yet, right? But Chinese people are not very good at talking about mental health issues, let alone feelings and emotions, actually. So I would say we actually, in the West, you're talking about stigma against mental health, for mental health issues. Well, we have to actually just deal with stigma against emotions and feelings. Anyways, got to start somewhere. But ever since I've become a psychiatrist, it is incredible how many people just come out of the woodwork now. And at family gatherings, at parties, people will come to you and they say, oh yeah, I have a neighbor with this issue, and can we just talk about it? And my next question then is, have you ever talked about this with anyone else? And oftentimes the answer, of course, is, are you crazy? How could I tell my doctor this? And so the stigma is everywhere. So the other aspect of stigma is there actually is other aspects of stigma within stigma. So even within mental health, there's stigma within the different conditions. And you can see this in our sector, whether it's professionals who work in these sectors or if even it's patients. And so I believe that addictions and substance abuse are at the bottom of the rung. That's the one where people are most ashamed to have. Next up, and then up after that, I'm not really sure. But I've noticed this because when you meet someone from one sector, we'll often get offended if you lump them in with another sector. For example, sometimes I'll have families who are, trying to promote and advocate for their youth with, let's say, autism, which is a brain condition, just like depression is a brain condition. But many of them will be so offended if we even mention that it's a mental health issue. Yet, at the end of the day in our system, who do they see? They still see psychiatrists and psychologists, not neurologists. So, in the area of child and youth mental health, of course, no presentation is complete without mentioning the famous quote, "Orphan of the orphan." So let's talk a bit about how stigma influences access to care. So it's hard to talk about mental health issues to begin with, and my profession has not made it any easier because my profession has been very good about blaming families for these issues. And so we did it with schizophrenia, blaming families for being emotional. We did it with autism, blaming mothers for being refrigerator mothers, and the medical model is blaming as well. So blame is simply not helpful. It's better to simply say everyone's part of the solution. Everyone has a role to play. And I'll just do a few slides to demonstrate how I imagine youth or my families might experience stigma. So here's a question for the audience. When youth have depression or suspect they have depression, who do you think they tell first? Do they tell a parent, a friend, no one, a teacher, or professional? What's the number one answer? Anyone? No one. Okay, you guys are brilliant. So no one is the biggest answer, 42%. And then friends next, and then family. And from an attachment point of view as well, as a child psychiatrist, it saddens me that often children and youth feel that they can't even depend on their family. These are the people that are with you. And it saddens me that we're in a culture where they value their friends more than their family. So that all is data from YouthNet, Simon Davidson and Ian Mannion's mental health promotion program. Here's another example of stigma. As a child psychiatrist working in the hospital, I had to do my time on inpatients like we all have to do. And there was a big difference between the children and youth that I would be seeing as patients when I was on pediatric inpatients on a medical floor, let's say for cancer, versus a youth admitted for, let's say, a suicide attempt or psychosis. The kids on the medical floors get presents. They get visits from the clowns even. And the patients on the mental health floor, nothing. And they don't get the cards from their classmates. They don't get visits from the extended relatives. What they do get from the families, of course, is don't tell your aunt, don't tell your grandparents. So it's very sad, the effect of stigma. And as a psychiatrist on call, my other experience is that people don't come until things are an absolute crisis. So many times we see people presenting in acute psychosis. And when we ask them, when did this start? The history will be, it started 6 months ago, a year ago, 2 years ago. Why didn't you get help earlier? And of course, it's the stigma. As a physician who wants to recommend interventions and treatments, I'm very grateful for colleagues such as mental health professionals such as Aaron, who have peer support programs. And at other times, we need to recommend other interventions. So here's an example of that. Let's say that you see your doctor and the doctor says, you've got diabetes, you need some medications for it. And what if the parent said, I'm sorry, but I don't agree with medications, they're just a crutch. I believe in doing things naturally. You know, how ridiculous is that? And as a psychiatrist, I dream of this happening. You know, when I can say something like, you have severe depression, your son is hearing voices, he's tried psychotherapy, we need medications at this point because nothing else is working. I would love someone to say, oh, what a relief to know what's going on, we'll do whatever it takes. But no. That's another sign of the effect of stigma. So we talk about, in the treatment area here, we talk about how we want to do things naturally, we don't want to do medications, and many people will brag about how they got over their psychosis without medications, right? They'll say, oh, you know, I was depressed too like my son, I got over it without medications, he shouldn't need that, it's a crutch. Personally, I'm thinking, of course, well, sir, you probably didn't have major depression like your son. You probably just had a bad day. But what I'm saying simply is that the stigma goes against the treatments, and people are ashamed to take the treatments that we recommend. And naturally, of course, I want to reaffirm that I'm not pushing medication because we only recommend medications generally if we've tried other interventions without success. And another example of stigma happens at the very end of the appointment. When I try and book a follow-up appointment with a family, and I'll say, my schedule's pretty busy, but here are some openings that I have. And then they say, well, I'm sorry, he's got piano lesson at that time. And at that time, he's got his Kumon. Can you meet us on a Saturday morning? Well, I'll tell you, my colleagues who work in oncology and are scheduling follow-ups for their kids to have chemotherapy, those parents aren't saying that. So that's another example of the stigma. You're laughing. Yeah, Mary-France probably has some even worse stories to tell. So at this point, let's move on and talk about research. So this was really easy, actually, talking about research in this area because there really is not much. The studies that there are definitely show that labeling is negative. Labeling can make peers be treated negatively. However, labeling is only a negative thing if people have a negative association with that label. So it's not necessarily bad to label someone as having depression. It's only bad if people have a bad view about depression. So this is important because as a psychiatrist, oftentimes by the end of my visit, I have to give a diagnosis. And so many times people say, well, we don't want him to be labeled. And the good news is the studies show that it's not the labeling alone that's bad, it's just what people do with it. Some studies have shown that although we said earlier that youth are an optimal phase to address stigma because they're young and malleable, the studies do show that if we don't really catch it early, things can actually get worse. In the area of discrimination, I'm not going to talk too much about this because I know there's others much more knowledgeable here, but it was shocking how little research there was on mental health stigma, and there's so much more in the area of race discrimination and sexual orientation. So hopefully there are lessons that we can learn from those other areas. Now, one of the questions I was asked to talk about was to talk about possible research priorities, because I understand there's researchers in the room. Well, as a clinician, it would be nice to know a bit more about how stigma develops in childhood and how it's maintained. It would be nice to know about a bit more about how it actually impacts people. And of course, most importantly, I think it'd be nice to have some more intervention research on what we can actually do about it. Now, as a clinician, I've actually wondered about what is the best way to beat stigma. The studies show that we can have people protest against stigma with public education campaigns. Sometimes this can backfire. Studies show that in other ways we can educate people. And I'd like to say something about education. In my own professional experience, I find the most powerful way to educate about mental illness is to show that it's not really an illness, in that mental health issues run along a continuum. And if you have just enough of a mental health trait or condition, it's actually a strength. So in my own field of medicine, it's a strength to have anxiety and obsessive compulsive disorder, because naturally if you're a surgeon, then your reinfection rates are going to be much lower. It's good to be obsessive, because then you'll be very particular about your work. And I'm looking at Marie-France not because you're obsessive. Just so you know. But you know, we can joke, right? Most physicians are obsessive to some degree. And those of us who aren't obsessive, right, they all have ADHD. And there's nothing wrong with having ADHD either. The more we learn about it, the more we are seeing it as an attentional difference. And where do our ADHD colleagues go? They work in the emergency room. They become our surgeons. They become our trauma surgeons. And so I think in terms of education, I don't know if this has ever been studied, but I think we need to educate people about the strengths of having mental health traits. If we go on and talk about other conditions like schizophrenia, excellent studies show that those with schizophrenia are often more gifted in the area of creativity. Those with mood disorders, once again, good literature shows that most of our famous writers and dramatists and many of those in the entertainment industry struggle with that, and that maybe contributes to their strengths in that area. And those with autism spectrum disorder, well, we wouldn't have computers, and we wouldn't have, without autism spectrum disorder. Learning disabilities, well, learning disabilities are one of the biggest reasons kids drop out of school. And if we look at who are the CEOs of most major companies, many of them have learning disabilities. So they wouldn't be where they are if not for that difference, or what we should say, learning difference, or learning differing ability. And of course, other than protest and education, the other most destigmatizing intervention would be contact. So definitely with me in my own training, I think the most powerful destigmatizing moments in my career occurred when I had worked with a supervisor or supervisors, and then later on I discovered, oh, so-and-so, he actually had tried to commit suicide, or so-and-so actually had such and such psychotic break when he was in university. So seeing those that I respect and admire, seeing that they had overcome mental health issues, most destigmatizing. Of course, contact is easier said than done. For any given child and family, it's really hard to ask them to go out on a limb and disclose when conditions are so negative right now. So it's really easier said than done. At this point, I'll finish off by just doing a quick scan of some of the interventions for child and youth stigma out there. This is a non-exhaustive scan, so if any of you know of any more, feel free to let me know afterwards. So there are mental health promotion programs by agencies such as Center of Addiction and Mental Health, specifically for children and youth in a high school setting. And then there are also mental health promotion initiatives for specific conditions such as psychosis. One of my favorites is Psychosis Sucks. Very youth-friendly term there. And there are programs such as the Honoring Life Network that targets Aboriginal youth. There's the Mental Illness Foundation in Quebec that has a very successful program. And there are mental health promotion websites like mindyourmind.ca from London, Ontario. At my own hospital, the Children's Hospital, there are programs such as YouthNet, which does a lot of work promoting mental health, and they have a lot of materials on destigmatization. There is the Dare to Dream program out of the Ontario Centre of Excellence that actually gives money to youth in order to do a destigmatizing project, with the idea that youth know best on what will help destigmatize. And then, of course, there's the Mental Health Commission of Canada with their anti-stigma, anti-discrimination initiative. And I presume that there'll be more talk about that later today or tomorrow. And so as I look through my notes, I see that that's it. So thank you very much for your attention.